especially on days like Diwali, Holi, it can be very emotionally disturbing for them. And emotional trigger can also exacerbate your underlying asthma. Plus, staying alone, not being able to vent out, can give rise to other psychiatric disorders like depression.
Happy Diwali, sir.
Happy Diwali.
I'm Dr. Tanvi. I'm a medical liaison officer from MyTatva Care. Thank you so much for giving us your valuable time today. Before we start, could you please introduce yourself, sir?
Hi, I'm Dr. Kapil Salgia. I'm a consultant pulmonologist and a sleep consultant at the Bombay Hospital and Medical Research Center, Mumbai, Bridge Candy Hospital, Shriya Diagnostic Center, and Kapil Polyclinic at Prabhadevi. So I specialize in all respiratory disorders, especially related to the airways, interstitial lung disease, infections like tuberculosis, and sleep apnea.
We are interacting just days ahead of Diwali and the onset of winter season in India.
Yes.
As pollution levels always rise during Diwali, how does that affect patients of COPD, asthma, or respiratory disorders?
So starting from now, with the onset of winter and Diwali crackers, the air quality index in the country definitely goes down, especially in a city like Mumbai or Delhi. And all our patients with respiratory conditions like COPD, asthma, if they don't take care, then there are significant chances of exacerbations for them because of the dust, the smog, the pollution, which leads to increase in the respiratory system manifestations.
What precautions can be taken by the patients and their families during this period?
So one important thing that I would like to say, all patients who have chronic airway disorders like asthma or COPD, they should be complying with their inhalers. They should be taking their inhalers regularly, not skip dosages. Apart from that, early morning activities, because of the smog levels early in the morning, and if they go for a walk, it can aggravate their respiratory symptoms. If the air quality index is poor or there is a lot of pollution, especially the days there are crackers, then they should ideally wear a mask and get out. They should try to avoid smoking or exposure to any smoke during these few days.
Why do chronic respiratory disorders worsen during the winter season? Are there any winter specific triggers that the patient should be aware about?
So in winter season, apart from the cold season, which might actually change the environment and introduce certain viruses which can trigger a respiratory tract infection, but more importantly, it's the smog, the increased urban pollution which mixes with the cold dense air, which gives rise to a layer of smog over the city. To add to it, car exhaust, firecrackers, crop burning in Delhi, all these things factor in. And this increases the suspending particulate matter, the increase in sulfur dioxide, nitrogen oxide, and all other polluted materials in the atmosphere, which gives rise to aggravation of respiratory conditions like asthma and COPD.
How do healthcare platforms and health tech platforms help patients to self-manage conditions like COPD and asthma?
So, patients with COPD, asthma who are enrolled into healthcare platforms, so I guess they have regular physiotherapy sessions which they teach the patient, which helps them. The breathing exercise definitely helps the patients. Apart from that, they also provide digital spirometers to the patient, so a patient can monitor his pulmonary function test at home. In case if they realize that there is a drop in their lung functions, then they can get in touch with their concerned pulmonologist to intervene and step up the treatment if it's suspected to be an exacerbation.
What lifestyle changes would you suggest for patients to avoid COPD, asthma, or respiratory conditions?
So I guess the lifestyle changes remains the same. So if you are not smoking, please don't smoke. Vaping, hookah, smoking, all are the same. If you have an underlying respiratory condition, then try to wear a mask, especially where the air quality index is bad or if there is a epidemic of infection going on. Exercise regularly, maintain good eating habits. If you feel there is a certain trigger which exacerbates your respiratory condition, then definitely avoid that. And more importantly, if you are on an inhaler, please do continue with the inhaler rather than stopping it and using it only when you are symptomatic.
Can nutrition and certain supplements help with lung health of patients?
So a well-balanced meal which has fruits, vegetables, in vegetarian sources of protein like dals, in non-vegetarian sources of proteins, eggs, fish, meat, dry fruits, everything is an integral part of your diet. So if you are taking that, I guess that takes care of your nutrition. Eating a healthy diet, small frequent meals, avoiding late night meals, avoiding alcohol, smoking, definitely that takes care. But suppose if the person is a little elderly, we can definitely add certain nutritional supplements. If they have associated, in COPD with elderly people, you can have osteoporosis. So in that cases, addition of calcium, vitamin D3 supplements, B12 supplements, and multivitamins, multiminerals can always be introduced, and it will help the patient.
Can you tell us about how MyTatva has helped your patients?
So MyTatva, basically, a lot of my patients do get registered to it. I am using this app for their obesity control, especially with diabetes. And after stringently following it, and I guess they're getting a regular update between the caregiver, between the app provider as well as the patient. So it has caused significant amount of weight loss in a good group of my patients, which has helped control their diabetes along with the medications. Also for few of my patients with airway disorders, that digital spirometry, so the patients are aware about their health status and they get in touch with me if there's a drop in lung functions.
Any advice on how to mentally and emotionally cope with managing COPD or asthma?
So asthma, that way, is a disorder which once given inhaler, it is not a progressive disorder. It can be very well controlled and a person can have a near normal quality of life. It's only during an exacerbation, if his asthma is not well controlled, they do get the attacks of breathlessness. The common emotional problems is, I guess, when kids have asthma, the parents are always very hyper. If a young girl has asthma or a young kid has asthma, parents are very hyper, especially if they are of marriageable age. So that's the issue. So that we need to address. It's a problem which can be solved and patient can maintain a near normal quality of life. COPD, on the other hand, is a progressive disorder, and as the years pass, there is going to be a decline in the lung functions. With inhalers, you may slow down the decline in lung functions, and as the age progresses, there are associated comorbidities like cardiovascular comorbidities, diabetes, hypertension, then not being able to go to work. Sometimes they become oxygen dependent, they become BiPAP dependent. So at those points of time, they feel they're of no use. They are financially draining the family, not being able to get out of the house, do their routine activities. So that can be very emotionally distressing and can give rise to depression in that group of patients.
Any other tips for patients apart from COPD, asthma, or diabetes, hypertension, or obesity?
So I guess lifestyle modification is very important, and you don't have to start a lifestyle modification once you get an illness. Intervening early to maintain a healthy lifestyle, avoid smoking, excessive drinking, exercising on a regular daily basis, eating healthy, avoiding late night binges, cutting down on the intake of your sugars and salts, controlling your weight are something which is very important for all of us to remain healthy over a period of time. And if you have an underlying respiratory disorder, please follow up with your pulmonologist, follow the treatment plan, take your inhalers regularly, and identify your triggers, wear a mask wherever possible, and most importantly, get vaccinated. You have the influenza vaccine which you need to take once in a year, you have other pneumonia vaccines, so get in touch with your healthcare provider and take regular preventive shots.
Sir, there are a lot of studies going on about how loneliness has become an epidemic in India. What are your thoughts or advice on that?
So definitely with urbanization and the shift and drift of people from smaller towns to bigger cities for jobs, they have been in a big family, celebrating festivals, coming to a city like Mumbai, staying alone with no family, not many friend circle, especially on days like Diwali, Holi. It can be very emotionally disturbing for them. An emotional trigger can also exacerbate your underlying asthma. Plus, staying alone, not being able to vent out, can give rise to other psychiatric disorders like depression. So I guess most importantly, people are staying alone. They need to gradually become a part of a group, form a circle of friends, get adjusted and adapted to the environment around them. And I guess most importantly is communication. They need to communicate. So if they're communicating, the loneliness feeling can go down.